Hey everybody, are you using or thinking about using Ozempic to lose weight? How does it really work? Are you afraid of the side effects? Does it even have long-term side effects? Ozempic is certainly a drug that has hit the news in popularity for weight loss. But here are the facts so you could understand. First of all, Ozempic is what we call a GLP-1 receptor agonist, which is a class of medication that we have been using to treat people with type 2 diabetes for a very long time now. It was a way to help them get better control of their diabetes. And you know what? Not only did we notice that their diabetes was getting better controlled, but we also noticed those that were overweight and obese were actually losing weight. See, once we realized people was losing weight with this medication, we started testing this out on people without diabetes. And clearly, if you recall, there was a famous randomized control study that was done and published in the New England Journal of Medicine that did show people lost significant amount of weight. So how does it work really? See, Ozempic is not insulin, so it won't drop your blood sugar levels like insulin does. The way it works is by mimicking what would happen in your body when you eat. That's right. It mimics what happens in your body when you eat by acting on natural receptors on the cells that are in your stomach, as well as the cells that are located in your pancreas and the liver. I'm not sure if you're aware, but when you eat, a hormone called gastrointestinal peptides are released and causes the stomach to feel full, and it slows down the digestion process. It causes the pancreas to release hormones like insulin to absorb any glucose in the bloodstream that is made by the food you just ate. And then finally, it prevents the liver from producing more glucose in the bloodstream during that time. But in addition to all of that, that hormone sends a signal to our brain to tell us to stop wanting more food because we're full. I bet you never knew that this entire process takes place each time you put something in your mouth. I mean, hormones are hard at work even when you're not thinking about it. And it happens in seconds after you eat. So what Ozempic basically does is it triggers these receptor cells in the stomach to release these hormones to do the same exact thing, but this time without you having to eat. You see, you would feel full, your blood sugar will be controlled, and you will not want more food. It's that simple. Now, all the randomized studies that were done on this has shown that not only does it work, but it's reasonably safe. See, so I'll tell you this though. There are some side effects, right? Some common side effects is nausea and vomiting and constipation, for instance, which, by the way, should not surprise you in light of the way it works, right? Now, it also tries to make sure that you stop eating. So that's part of it. Now, there have been some concerns about whether it causes like acute pancreatitis, but there's no causal relationship based on all the studies that I've reviewed so far. Now, there are some reports of saying that it causes some hypersensitivity reaction, which all would happen immediately if it were to happen. That would mean that you'll get a full-blown allergic reaction to this thing. Either way, the side effects profile to this thing is mostly immediate, not long-term. Although there's new studies coming out about whether it's causing gastroparesis or not, but that's left to be determined. But remember, if you're pregnant, you should not be using this medication. And if you are using it, you should stop at least 2 months beforehand before getting pregnant. Anyhow, so far, this is the updates on Ozempic and similar medications like it. All right, I'm Dr. Coupet. I'm the People's Doctor. Thanks for listening.